Breastfeeding is natural and has benefits for both mums and babies. It should be easy and trouble-free, and a good start helps to ensure that it's a happy experience. All mums are capable of breastfeeding exclusively for 6 months, producing more than enough milk. Breast milk contains antibodies that help protect against infections. It's not necessary for mum to eat or drink anything in particular in order to breastfeed. To establish the process, the early days are crucial, and the trick to breastfeeding is getting the baby to latch on well. A baby who latches on well will get plenty of milk. A baby who latches on poorly has difficulty getting milk. Your baby will receive colostrum in the first 3 days, and he should be sucking enough to keep him settled and content whilst lactation gets underway. Milk supply will increase at around 3 days after delivery, but it's important that the baby is put to the breast within the first 12 hours. The suckling of the baby will help stimulate the release of hormones, which kick-start the lactation process. Correct positioning and attachment will prevent damage to the nipples. Follow what your baby wants to do. You'll get better and better at following his cues. He may want both breasts every time, and you can offer the second when it's appropriate. If he doesn't take it, or only for a short time, offer that breast first next time he wants a feed. Get off to a good start with these tips on positioning. Support her neck and shoulders between your spread-out hand. Your baby shouldn't have to twist her body, turn or flex her head to latch onto your breast, so hold your baby facing you with her shoulder and hip in a straight line. Your nipple should be opposite your baby's nose. Support your breast with your fingers underneath, against the chest wall, and your thumb on top, away from the nipple area. Tickle her lips by brushing with your nipple. Wait until your baby's mouth is wide open, then bring your baby to you quickly with the chin first. Her bottom lip should first make contact with the areola, the brown bit, away from the base of the nipple. Your nipple should aim for the roof of her mouth towards the soft palate. Her mouth needs to be wide open. Pushing her head onto your breast can make her uncomfortable and resistant. Therefore, always bring her on when her mouth is at its widest point. When she is latched on, make sure that your baby's cheek is just touching your breast. Her chin should be pressing into your breast. Her nose should be clear and cheeks should be rounded. You should be able to see some areola showing above her top lip. Hold your baby close to you until she starts sucking, and once she is taking long, slow sucks, your hand should be brought to rest underneath her. She may need extra support to maintain the position, and you shouldn't feel any discomfort. You'll be able to work with the baby's powerful instincts to get it right. Initially, your baby will want to feed a lot, maybe 10 to 15 feeds in 24 hours. As time goes on, feeds will become more predictable. 5 ways to know if it's going well. Your baby takes the breast without fighting or coming off and on. He shows you he's contented after most feeds. He's developing well and gaining weight. Under a month old, he has at least 5 to 6 wet nappies every day and 1 or 2 soft yellow poos. After that, his poos may be once a day or every other day. Your breasts and nipples aren't sore. Don't be afraid to ask for support or advice. Speak to your midwife or health visitor.